Thank you so much, Sandra. Uh, Good morning, good afternoon, good evening to all my global audience here. It's such a pleasure to be with all of you and share our presentation. I am from India. My name is Kiran Modi. We will talk a little bit more about what we do in the next slides. But here it will suffice to say, I'm not liking to be in this black box with all of you here. I wish, I was there in South Africa. Last time NACCW's conference, I was very much there. What a vibrant country it is. What vibrant music I've never experienced in my life. So thank you again for this great opportunity. Karishma, over to you.
A very warm greetings to all the wonderful people on this forum today. I am Karishma. I'm a care leaver myself and one of the founding members of Clan Delhi, and I work as an HR in India.
Okay, so can we go to here we are going to present you the first ever International Online Care Leavers Convention, which happened last year, November 23rd, 24th, 25th. Can we go to the next slide, please? So who we are, we've already given a little bit of a glimpse in our lives. I am running these group homes in India where children without parental care, they find a family with us. And we raise them and we help them. And because of being so intensely involved, that care leaving and care leavers, they have become my priority area. And that's how we had thought of organizing this care leavers convention. We will talk about it little later. I would like, I can also tell you, we are running 17 these children's homes where 12 children as a unit or 2 units, that means 24 children, they live together like a family. So Karishma is also one of our daughters, and now she is a established HR professional in her own right. Karishma, please.
So if we talk about who are we, and as Kiran Bua explained her, I will do my part. And so I have lived a large part of my childhood and teens in the CCIs system and aftercare, fortunately, which I got when I turned 18. And my own experiences, brings me back and derives the passion in me to give back and transform the caregiving process. Because I'm passionate about children and young adults and the idea of giving back and making a difference. This is why I'm here.
So next slide, please. So let's tell you, how did this first ever International Care Leavers Convention happen in 2020? It was a conference like today, where it was possible to meet in person. It happened in Tel Aviv in 2019, where I met 3 like-minded people, Professor Skorir from University of Hildesheim, Martini Tobe from Kinder's Perspective, Netherlands, and Chathuri Jaisuraya from Sri Lanka. She represented SOS Villages of India. So the 4 of us, 3 of us were practitioners and 1 person was an academician. So it was like meeting of souls. All of us are so passionate about care leavers and the care leaving process that we thought we need to organize a convention so that care leavers, they can come together globally and voice their concerns and share their joys and pains. So in Tel Aviv, it started that we should be doing it. But why? At that time, we thought we would do it in person in Delhi. But as all of us know, it was supposed to be in March 2019. And very soon we were 2020, and very soon we were all assailed by COVID-19. So all the plans, actually, they went out of the window, and we started wondering what to do next, because in-person conference was not possible. So we decided that we will do it online, and throughout the year, we started, meeting care leavers globally, and we discussed with them the possibilities of organizing a conference. Can we go to the next one? So Karishma, would you like to talk about it? Why your story needs to be out there in the world?
I think I already talked a bit about it, Boa, where I said that, I'm a caregiver myself and I have lived a large part of my childhood and teens into the system. And I mentioned that fortunately I was given the aftercare facility, and that made a lot of positive difference in my life. And I feel there are thousands and thousands of young adults who are out there, and their stories are now not out there, and people don't know what care leavers are. So I feel that it is important for me and young adults like me to come forward and make people aware what care leavers are, what is the term all about, and what our needs and demands are, so that these needs and demands are being addressed, so that we have a beautiful world and a world of equality and happiness.
Beautiful. So actually, we all realized, we felt very, very strongly that a platform needs to be created where care leavers from across the world, they can deliberate together with greater breadth and depth on care leaving policies, laws, on their experiences as experienced by different youth coming out of different alternative modes of care, who are deprived of their own family network. How do the current policies and practices impact them? How can things be improved for their development and growth? How can their mental health policies be framed in such a way that they can have a huge impact on them, and so that they are able to deal with the issues of familial separation, loss, deprivation, all that they face before coming into alternative care. So this was the idea, and this is our story, that we all felt very strongly that a platform needs to be created. Next, please. So this is our organizing committee. So if you look at the line below, Kinder Perspective, Martini Tobe, and I'm sure a lot of FITSE members are here. So you might be aware of Martini, who represents Kinder's Perspective. Then University of Hildesheim, they've been working a lot, even though they are academicians, they're working a lot with care leavers. SOS Children's Villages International, they are all over the world and they are dealing a lot with care leavers. And Udayan Care. Udayan incidentally means sunshine. And the idea is to bring sunshine into young lives. So we have been dealing, as I told you earlier, with children and youth. So the four of us, we decided to come together. The next was, Karishma will tell you about the 4 care leavers groups, networks, who also joined hands.
Yeah. So as Kiran Boa talked about the 4 organizing committee, and along with the 4 organizing committee, there were 4 different care leavers bodies who were supporting the organizing committee alongside the activities, the presentations, the moderations, and whatnot. So one was from India, which is Clan, Generation Never Give Up is from Sri Lanka. Then we have Latin America, and what is fourth?
Zimbabwe.
Zimbabwe. Yeah. So we had a lot of
Zimbabwe
care leavers.
Yeah.
Yeah. So we had a lot of care leavers from there, and they were absolutely wonderful throughout the process. And we learned together. A lot of perspectives came out. Also, after this, out one of the key takeaways was having a platform for all the care leavers, and that is there. Like later on, we're going to talk about it.
Great. So can we go to the next slide, please? So let's see what happened on from November 23rd to 25th, 2020. I think these were historic days. We created a platform on which we conducted the convention. The delegates from 83 countries were there. These included dignitaries, world reputed researchers, child rights advocates, policy makers, and the most important of them all, care leavers themselves. So imagine, almost 2,500 plus participants. And if you look at 50% were care leavers themselves. So this shows that care leavers community is so vibrant and they want to talk about their own experiences and they want to make the world aware. Karishma is a living example. So before the convention actually happened, we did 4 pre-events which were leading into the convention. But if we go even before these pre-events, we globally, we were meeting all the care leavers, and together they had developed a declaration, about which we will talk in the next slides little later in the presentation, which talks about the declaration where all these care levers globally, they got together and examined the COVID times and the policies and how constraining it is for them to develop. And they declared certain things, that they demanded certain things, which we will talk about it little later. Once, the declaration was done, we organized 4 pre-events which were leading into the main session. These pre-events, each pre-event was planned by one of the main organizing committee members along with care levers networks. There were sessions on, once, it was on my voice, how do I project myself? The second time it was, how do networks help us in projecting our thoughts? And the third and fourth session were both related to research around aftercare. So many were researches conducted by youth, by care levers themselves. So all these 4 sessions, pre-events, they really kind of, established the context. And then the 3 main days happened, 23rd to 25th. And a lot of sessions were happening where the care levers themselves were the moderators, and we invited people and organizations from all over the world, and they presented their thoughts on care leaving and what can be done and how it can be improved. Then there was one cafe session specially made out for Latin American care levers, because it happened according to India time, which was suitable to Africa, Asia, and parts of Europe, but it was not suitable at all to Latin America and the other Americas. So this cafe session was specially done for Canada, Latin America, and Americas. So it was a very interesting session. And then, of course, a closer session happened, which we did with the governments. 11 government members of different countries, 11 countries, they participated in that closer session. They heard us out patiently, where care levers put forward their own demands and their charter, which they had developed. So I think all of you would be very much interested in knowing what were the charter of demands which Karishma and all the other care levers came up with. So I would hand it over to Karishma now. Can we go to the next slide, please? So can you please click on, I think there are 4 points here. Yeah. So Karishma.
Yeah. So if we talk about our first, so basically I would like to tell all of you that there were more than 25 key takeaways, but then we worked together, all the 4 organizing committee and the 4 different care levers network, we came together and we decided that we will only present the most important ones. So there were more than 25, but right now we're going to only look at 8 very, very important ones. So first, talks about the first key takeaway talks about that we need to build an international care levers network and work towards the second international care levers convention, which is in the year 2022. That is what we are assuming that we're going to do. So the international care lever convention that we did in 2020, it brought a lot of perspective in, and a lot of people were there on the forum. A lot of them got aware about the term care lever, and after the convention, a lot of people even started working towards the betterment of care levers. Talking about the second key takeaway, which talks about our declaration. Uh, so if you get an opportunity to look at the declaration not only talks about the problems or the issues and the challenges and the recommendations that we had in COVID times, but these challenges were always there for care levers. It's just that in the times of COVID-19, these challenges got intensified. So when we talk about declaration talks about the challenges and the recommendations. So in the month of, you can say, June, a lot of care levers all across the world came together. There were more than 100 care levers, and they talked about their challenges and issues. And it was very interesting to know that it was not only in India or Germany, or you can say in Netherlands. All the care levers, somehow they had similar kind of issues and problems, though they were coming from very different backgrounds and countries and culture. So basically, in the second key takeaway, we want to say that we want to spread our declaration and advocate for a declaration by care leavers in the times of COVID-19 amongst the policymakers around the world, so that the people are aware about our declaration, our challenges, and the recommendation that care leavers are giving in it. Coming to the third key takeaway, give me a second. Yeah. So third key takeaway talks about that we should have a seat at the table at the national and international forums, UN and etc. And why, when we were having the international convention, a lot of care leavers came forward, and we talked about that, care leavers are so invisible. People making policies for us have not lived our lives, and these policies have big impact on us. So we should be involved in the process because our perspective and lived experiences are precious. We want, a space where we can voice out the thousands and thousands of unheard voices. As caregivers, we are no longer children. As adults, we should be taking our own decisions, and government should consult us in making all policies for us. So basically, nothing for us without us. Coming to the fourth key takeaway, which talks about we need free and quality access to mental health services after leaving care. So we basically leave care after 18, and the ones who are really fortunate, they get the facility of aftercare. So till 18 you're in the system. After 18, you it's your right to get aftercare, but in not scenarios young adults get that. So when I talk about mental health and young care leavers, when after 18 they are moving out, they should have access, to free mental health services. So coming to this, why is it even important? Why is it even important to be healed from your past traumas? Why are children in system? Why are even children coming to the system? So there are various reasons. There could be thousand reasons that children at different ages they enter in the system. But here is one thing which is very common, and that is repetitive traumas. So later, when a child turns 18, they go out because that's what the policy is. So imagine the years of unaddressed trauma and its complications. Do you think that it is fit to stay out with absolutely no support for that young adult? Do you think it is healthy for that young adult to be out there all alone? And the people around them, do you think that it's fit for that young adult to be out there without having addressed and completely healed those traumas? I don't think that they are fit to work or to be in the society. I would love to know your views. So please use the chat box and write your comments there. So I would also talk about this, that when these traumas are not, being addressed, these repetitive traumas, they're not being addressed. So, and they're going to schools, they're going to colleges, they're going to work. It's just not fit for them. And also, do you think that they are even aware of these traumas and how it's damaging them? Do we have resources to address these issues? Do you think healing is important for their overall development? So these are the questions that we need to think about. And as I said, please use the chat box to write your comments and give us ideas how we can address this problem. Going to the fifth, next slide, please. So fifth key takeaway talks about that 25 should be new 18, soft landing from planet youth care to planet Earth. So planet youth care to planet Earth. So before 18, because of various reasons, we are not allowed to go out of the settings and the system because of the safety reasons, and there are so many other reasons. The policy is really strict because the policy, they want to make sure that we are protected and nothing is happening to us. But unfortunately, we do not get the exposure of the world outside. We lack life skills, we have trust issues, we face identity crisis, we have security issues, and we are highly vulnerable. We do not know many things. We are too naive at the age of 18, and it is difficult to understand or relate. For you, if it is too difficult like to understand or relate to what I'm saying, just ask yourself, when you were 18, were you taking care of your life entirely all alone with absolute no support? And also having repetitive unaddressed trauma. So you are 18, you're out, just think about it. There is no support for you, and also you have repetitive unaddressed traumas. So imagine the combination, how dangerous it is. So so when we are asked to leave, care after 18, we feel helpless and scared. We ask ourselves who is there for us. We just do not know how to manage all the responsibilities and excel in life at the same time. Time is crucial, and I know it is important to struggle, but we are suffering. And we are huge in number. Thousands and thousands of lives were and are at stake. Coming to the sixth key takeaway, which talks about um, yeah. So we want caregivers who are well trained and understand us, accept us, and nourish us. We want to be better prepared for leaving care. So the transition phase for the child should not only start on 18, but it should start as early as possible. There should be individual, care program or planning for young adults, and it should start as early as possible so that we can give the best to the child. Coming to the seventh key takeaway, yeah. So we want more participatory research on our strengths, resilience, and challenges so that we can explore our strengths. And these research would also help in our development and also to people who are working with and for young adults. Talking about the eighth key takeaway, we need a proactive rather than reactive approach to mitigate the challenges and adjustment difficulties faced by caregivers. Implementation is the key. It is really surprising that we are huge in number, but when we look at caregivers, not much data is available. So we are really huge in number, but then there's no data available. And we are so very invisible. Here, the question is, are we tracking and following up with young adults leaving the different care settings and systems? If not, then why? Don't we matter? When we are not following with these young adults, how are we addressing their challenges in the times of need and emergency? The question is, are we even prepared to address their issues? There is a lot that we need to think about. Lives are at stake and we must take it very seriously. Coming to the ninth, you can see the eight, and then there's an arrow which says, help us move forward in the best way possible. So I really request and appeal to all of you on this forum. I know all of you have worked really hard to sit where you're sitting, and a lot of effort and hard work has been put into your career and into your lives to be there where you are today. And you hold so much power to make difference in so many lives. So talking about help us move forward, work with us for us, absorb us in the system. We have lived your policies and system and much more. Give us spaces and platforms to voice out our lived experiences. We have stories to tell, and let us lend your ears so that you can hear and understand our challenges and problems so that the system and the policies are done accordingly. We are standing with open arms, embrace us, protect us, and empower us. We need the same things as your children need. You are the guardian, and we are your responsibility. Thank you so much.
Karishma, beautifully put. So, I think this kind of an appeal would touch any heart, and the whole issue comes out so alive. So this convention, which lasted for those 4 pre-events, which I talked about, then I talked about those 3 days and leading up to the session with the governments and the Latin American and Canada Care Leavers Cafe, all that, we put together in wonderfully written reports. There is a convention report. There is a brief that we developed for practitioners. And this brief is sounded by care leavers themselves. What do they want practitioners to address? Then there is a brief for policymakers. Again, it is coming from the care leavers themselves. So it is so participatory. They are laying bare their hearts. They are laying bare their problems. It is out there for the world to imagine and to see and react. So all this is available on Care Leavers community website, which we will just tell you about. But before that, I spoke about the declaration. Why don't I spend just a couple of minutes, or maybe Karishma can do that much better than me, because it is right in their hearts. So can we go to the next slide where Karishma will be talking about the 8 or 10 points, which they took up as the declaration points, a charter that they developed.
Yeah, just give me a second. Yeah, I think I already talked about it. So when we talk about the declaration, I did mention that more than 100 care leavers across the world came together and they talked about their challenges and issues. And it was very interesting to know that though they were coming from different boundaries, different cultures, different backgrounds, but they had similar kind of challenges everywhere. So declaration not only talks about the challenges and the issues that we had in times of COVID-19, but these challenges, they were always there and we were facing these challenges. It's just that in the times of COVID 19, it got really intensified. And the declaration talks about not only the issues and the challenges, but it also talks about the recommendations. So if we look at the declaration, it talks about financial security. So after 18, why is it important to have a financial security? Housing, education, accessibility, career support and employability, psychosocial support, health, nutrition and hygiene, physical health, legislative policy reforms, awareness and identity, participation, social network, inclusion, and social protection. We are working
So
really strong. Yeah, please
yes,
go ahead.
dear audience, you can see that the care levers are so clear. They know the problems and they also know the solutions, which are right here. Let's go to the next slide and see so many organizations world over, they've endorsed this. So endorsed this declaration, and now it should not only be endorsed, it should also be worked upon. That's our aim. And for that, we really need your help. Can we go to the next slide? Where we talk about, we have developed a community, a community website, and we need your help. Many people are here who are working with care levers in different capacities and in different roles. Can you get your national care levers organizations or networks to the website careleverscommunity.org? When the convention happened, one demand came out very clearly that we want our own platform. And towards that end, we developed this careleverscommunity.org. It already has some material, but it really needs to be strengthened, and we need your support. The final report, the briefs for policymakers and practitioners are all there. Please download and read them and try to share with as many people as you can. Already, these have been translated into different countries and people are using it. So kindly help us into this, and also motivate care levers in your networks who can join the Care Levers Cafe session, which we do on a monthly basis. And Karishma is again one lead there. And there are many other care levers who take turns in organizing these monthly Care Levers Cafe sessions, which happen every Sunday and India time, 7 p.m. in the evening. So we would be very happy that more and more care levers join these cafe sessions, match their aspirations, match their problems, and come up with solutions. Next, please. Karishma, would you like to?
Yeah. So when we say miss the boat, so maybe never forget all the care levers who have missed the boat. So we are basically talking about care levers who are not being tracked. There's no data available of them, and they are just lost outside because there is absolutely no support for them once they turn 18 and they are out of the system. So there were and there are still many young adults who were not so fortunate to even attend a very primary schooling. Knowing about their rights and duties, coming on a Zoom call is a far thing for them. So they merely know about the fact that they have a voice and they can stand for their rights, and they can bring a lot of changes in the system, in the society. So we have to reach out to them and provide a safety network and a system where they can fall back in times of need. Thank you very much to each one of you. I am so very glad that I could become the voice of many lost voices. Data around
Wonderful.
them is not available. Yeah. So it is very,
Wonderful.
very important that we keep a data on care levers so that we can reach out to them and support them and help them in all the capacities that is possible to make their life beautiful and help them in developing all the skills that is needed to live here on the planet.
So this last slide, thank you so much for listening to us. And you can see that snowball, how it is actually snowballing the effect. It starts with this little speck of an ice, and then it becomes bigger and bigger and bigger as more and more people start becoming aware. And that's where we are. We are really wanting it to become a real big movement. And for that, everybody needs to be involved, whoever is working in the alternative care field. And this snowball effect, again, this came from Martini Tobe, and I owe it to her. I hope she's here, and she should have spoken because she was also one of the architects of this whole convention. And we are all now waiting for 2022, when the second Care Levers International Convention online will happen. And we would, of course, invite everyone, and we will be in touch. Thank you again from Karishma, a care lever, and Kiran, who is a practitioner. Thank you once again. And we would love to answer if you have any questions. I don't know if we still have time.